The views and opinions expressed during this show do not necessarily reflect the policy
or position of any affiliated workplace or employer. The views and opinions of the show do not constitute recommendations for therapy.
Please contact a licensed SLP for individual consult on your situation.
Please listen carefully.
What is communication?
An essential behavior of life. We have the both blessing and responsibility of trying to foster another.
It's transmitting a thought from one person to another.
It's the strongest way for two people to convey information to each other.
The back and forth between two people.
Communication is a lifeline.
Just connection with other people.
Connecting people in terms of ideas or thoughts or needs.
Draws us out of ourselves, draws us into that relationship, builds up our families. Without it, we'd be lost.
Whatever it is that we do to express intent and achieve an impact.
Communication is the ability to express your needs, wants, frustrations, and desires to anyone that you feel needs to have that information.
Welcome to Speech Science episode number 143. I'm Matt Hott, a school-based SLP and also an SLP working in home care with dementia and stroke rehab. Joined as always by Michelle Wintering, an early intervention speech and language pathologist.
Hi, Matt. Usually you say pediatric SLP.
Do I? I was trying to figure out why I was so clunky on that introduction.
That's all right.
Our third wheel of the tricycle is not here this week, Mike McLeod. He is out. So we are joined by our special co-guest hosts this week, Ruchi Kapila. She is an SLP and a vocalogist, providing gender-affirming voice services in their private practice, Kapila Voice and Speech Services, and is also the co-creator and co-host of the Hyndsyte Project podcast. Ruchi, hello.
Hi, it's so good to see you, Matt and Michelle. Thanks for having me.
No problem. Thanks for joining us on literally 30 minutes notice of of everyone that follows the show. We all know Mike's got a new baby, so of course that means time frames go away. Mike sends a note at 8:45, and I sent a note to Ruchi at 8:46 and said, "What you up to in 30 minutes?"
And as a result, I prematurely promised to Matt that I won't have children for the next 5 years. So
prematurely promised. All right.
Prematurely promised.
Hey, man, I'm not saying, but I am saying that since this show has been on the air, 5 children have been born to 3 co-hosts. Just saying.
I mean, I was pregnant when I started hosting with you, Matt. So that was a head start, at least.
But the show was on air when the pregnancy started.
True.
I'm just saying.
So I've had 2. There you go.
I've
did
had
any
2.
of these did they coincide with pandemic?
No.
Very well. Mine was born in December, my second.
Yeah, okay. Yours is a pandemic baby.
Technically, I guess.
Congrats, Michelle.
Yeah. Thank you.
We were pregnant a month before the pandemic started, so no.
Yeah, Ruchi doesn't know that all 3 of the hosts here have had baby girls in a very short time span.
You have a built-in support group. And
it's true.
The Venn diagram of podcaster, SLP, and assigned female at birth child is perfect.
Yes,
so,
it's true.
Nice.
And it's a first child for Mike, a second child for me, and a third child for Matt.
Yeah, it's all old hat at this point.
Right. I know where I'm going for advice. So
on today's show, we are not talking about birth. We are talking about how do we handle the trauma of students and our private practice patients returning to in-person therapy after so long of doing digital. We're also going to talk about a new study looking at dry mouth, dysphagia, and Parkinson's. We've also got our SS Pod due process and the SS Pod shout out and the ASHA spotlight. But first, we always want to hear from you. So make sure you head over to our website, speechsciencepodcast.com. And from there, you can give us a phone call, 614-681-1798. You can email us at speechsciencepodcast@gmail.com or check out our Discord at discord.speechsciencepodcast.com. Michelle, what has been going on with you this week that is, you can either go therapy related or you can stay out of the therapy realm. What has been going on?
It is hot. It is hot here. It's actually been really good. We've been able to get outside more and enjoy some water and sunshine and prepping for our move to Texas. So I'm trying to purge, get rid of things, make the move easier.
How many weeks till the move?
About a month.
Okay, you got time. burn everything.
Yep.
Just get rid of it.
Pretty much. That's how I feel every time we move. The other thing you haven't mentioned yet, Matt, which I know is podcast related and speech related, was that we are up to 100,000 downloads. On
So I wasn't going to mention that on air because I'm an idiot.
Why?
Okay. So, okay. Now that you bring that up. All right. So Podbean just gave out awards and I thought we were at 100,000 and we're actually at like 191. Evidently we did that 100 like a while ago and I just wasn't going to make a big deal out of it anymore because I'm a complete moron when it comes to looking at anything on our podcast.
Well, we're almost at 200,000 then. We are nearing 200,000 downloads. So download this episode.
However, I do have stats about where we are and I was trying to get them in Discord and our number one country of download is the US, but number two is what up to our Australia folks and then Canada, UK, New Zealand, and India. So.
I would have been surprised if it wasn't the US.
We're the number one show in Canada.
That'd be great.
Well, now that you've seen that Matt has no idea what's going on in his show, let's go to a podcaster that knows what they're doing. Ruchi, how have you been? What's up with the Hyndsyte project? What's going on in the past week for you?
Oh, okay. Well, Hyndsyte project should be ramping up to record new episodes soon during the summer. I have a couple of really exciting hosts and as well as guests to have on and share their stories. The other big thing that came up for me last week was on Saturday, I presented at the Northwest Art and Science of the Performing Voice Conference. So that was under Dr. Kari Reagan. Special thanks to Martin Abdal as well. And so I presented on working with transmasculine singers. I also announced Kapila Voice and Speech, my new practice.
I saw
and
that.
Michelle, speaking of Texas, I'm going to be flying out to see my partner next Wednesday to see my partner Blake in Texas for the first time in over a year.
Oh, that's wonderful.
So
I'm glad you'll see each other.
Yeah, thank you so much.
In person. I know we have this awesome technology and we can see faces. But
yeah, I mean, definitely kept everything going, kept everything continuous, but it's time to see each other again. So I'm pretty excited about that. So
you did a presentation on what was it?
On working with transmasculine singers. And so for the scope, it was particularly people who've taken testosterone, and some considerations about that. But, transmasculine singers are under a much broader umbrella. Some people take testosterone or T and some don't. A lot of people explore gender identity and how they want to work with their voice in myriad ways. So it's a very complicated topic, but I tried to cut it down to something that fits in 24 minutes for a breakout session.
There you go.
And it was mostly successful.
That's perfect.
And I'm building my relationship again with PowerPoint. So things are good. Things are good.
Any of y'all folks that work with singers and do like that or the melodic intonation, like I give you all credit because even though I was in a music fraternity, cannot carry a tune in a bucket. And I've had a couple home care patients that are like stroke rehab that were like, I need to get back to singing lead. And I'm like, yeah. So I'm going to do an E sound and please don't be mad at me when I am super flat.
Matt, I still have space in my studio if you ever want. Okay.
Yeah. Okay. You know what? I'll call you and I'll let my people call your people. How's that? No, that's awesome though. Congratulations. That's awesome.
Thank you. Thank
you.
And
congrats on the, you said launching your private practice.
Launching
right?
a private practice.
Yeah. It's a wild week, but you caught me at the right time.
Always good to catch you when you're promoting something. That's how we get you on
sure.
here. For me, I have been not nearly as exciting as any of y'all. I went camping with my boys this weekend. And
I love your camping stories.
Oh,
Please tell me there's more.
So my kids learned what a cow sounds like at 2 a.m. and what geese sound like at 3 a.m. because we're all cramped in a little 2-man tent. There's 3 of us because one's 4 and one's 8 and I'm 35, so we can fit. And my 4-year-old wakes me up and he's like, or my 8-year-old wakes me up. He's like, Daddy. And I was like, what? It's like 2 a.m. I think he has to go potty. So I'm getting ready to go traipse across the field. And he's like, what's that sound? And it's like frogs and cows and geese. And I was like, oh man, I have failed as a parent that my kids can't identify animal sounds, and I failed as an SLP that we have never done animal sounds with my kids. But no, it was good. I had to teach my kids that it's okay to say no, and then I had to teach another kid to respect another kid when they tell them no about borrowing something. So that was a weird, I'm back to work, and I didn't want to work this weekend while camping. So that was fun.
You taught consent over the weekend, Matt.
I legit, like, it was something that I pulled out of a training where, like, so that my sons had the little finger lights, the lights you put on your fingers, and they look kind of cool. And another kid kept going to my 4-year-old asking for them. And my 4-year-old was like all hunched over. He's like, no. And I went to the kid. I was like, listen, if someone tells you no, you have to respect that and leave them alone. And then their kid was like, okay, whatever. And then walked away. And I was like, I might have changed the life or not. I don't know yet, but hey, some third grader learned. But that's about it. And therapy wise, I got one more week of school left, and then it's just home care all summer week. So
do you pick up more hours with home care in the summer, or are you going to kind of?
I used to, but now I feel like I'm just going to keep my normal caseload, and then as it ebbs and flows, I'll just add and drop and cover vacations. So that's about it. So moving on with a terrible transition to people doing something awesome. That is the SS Pod shout out. If you know somebody that is doing something awesome in the field of speech and language therapy or related, that's where you can head us up on the Discord or on the Twitter's hashtag SS Pod. This week, it is a shout out to a member of our Discord. It is MarissaMM. She actually graduated and passed her Praxis, so she is no longer one of our grad school listeners. She is a CF position at a preschool. So congratulations, Miss Marissa, and also all of our other grads out there, because it is that time of year. Do y'all remember when you guys passed that Praxis? Because I do, and I had a lot of crew to chat questions on my Praxis, and I guessed.
I was so relieved to have that behind me. Yep.
I think I did mine maybe 6 months before I was going to graduate. I did it way before comps.
We did it early too.
You can do it that way?
We did it early, Matt.
See, I was already in the schools when I did my Praxis.
Exactly. So you still did it before grad school graduation, though, like the year before.
I know this is podcast and radio, so I'm like thinking, no, because I had worked a year. Oh yeah, well, what? I was a weird student, so yeah, maybe.
Yeah, we'll check it under that, right?
Right.
Okay.
So there we go. Marissa and the other grads, congratulations, the SS Pod shout out. On the flip side, if something is bothering you and you need to take it to the court of public opinion, that is the SS Pod due process. So given to us, the tribunal this week is a anonymous write-in talking about what do we think if they have to wear a identification on their work badge of their vaccine status.
When you say an identification, what do you
mean? So something to let the patient know if their therapist is vaccinated or not vaccinated. And sorry.
I guess my quick reaction is, are we allowed to do that? But then my secondary reaction is, I've heard of people doing that for the flu shot already.
My knee-jerk reaction to this is, as a parent and as a person who had COVID in December, I want to know if the person I'm working with that's going to be working with me or my family has been vaccinated. I want to know that. So if it's a little sticker on the badge or a little ID, I'm okay with that. And I guess I would be okay with it as well as a therapist having to wear that.
I know.
Sorry, go ahead,
Go ahead, Michelle. No, I think it's totally normal in terms of all of the other things, like whether you're fitted for an N95, all of these other considerations in an inpatient hospital setting are automatically added to badges. So even if it's not enforced in terms of government recommendations, it's definitely going to be enforced in terms of individual hospital and healthcare settings, I would think. What do you think, Michelle?
My first thought, anytime something medical or health record related is, wait, is that allowed to happen? Right. But I also then I pause and think, okay, wait, but my employer asks me to get a tetanus and asks me to get a flu shot each year and has me get, and I have to get all these things and show them record of it before I can work there. So this seems to fall in line with that. I'm not used to it being something you wear on a badge. I haven't personally experienced that. I had a friend who said when they got their flu shot, they had a sticker on their badge that showed they had already received that year's flu shot. We didn't. That was just something we submitted to HR and it was taken care of.
I had to wear a sticker that said I didn't have a flu shot, even though I did, but I didn't get it from the nursing home I was PRNing in. So they didn't have record. I worked there like once every 6 months. So I didn't bring my like records with me every time I would go. And if I worked there during flu season, it would be a little sticker that says, I don't have a flu shot. And it was like, oh, I do, but whatever. And like none of my patients really cared, but
from a patient side, I could see though with a COVID shot, I mean, I think it would probably be well within a patient's rights to ask for someone who has been vaccinated.
Yeah. How would that work? How would you guys handle it if they came to you and said, I see you've been vaccinated. I want to work with somebody that's not been vaccinated.
Take this referral. Get off my case.
Would you? Yeah, it's easy to go.
I was like, yes, let's have some patient and client-centered care. Let's get you your non-vaccinated provider.
Have you seen
ASAP.
Not to go in down the rabbit hole of vaccines versus non-vaccines, but like I was reading a Vice article last week, and now the anti-vaxxers are wearing masks because they're afraid that those of us that have been vaccinated are shedding the virus while breathing.
I
have not seen that.
That's wild. I had somebody post on my wall recently on social media about like a vegan restaurant they were going to that was like not allowing people who are vaccinated to come in because it was apparently messing with people's menstrual cycles, because that's another thing that's been reported following vaccination, that people have had changes in their cycle in terms of length and timing, which is, stuff happens. Weird.
Yeah,
I feel like that makes sense to me that it would impact that, because any medical or stressful
to the person that got the vaccine though, right? Not because I was sitting next to them with my vaccinated body.
Right, to the person who received the vaccine. I'm
but
sorry.
you said
a second.
The
Were
restaurant
you asking for confirmation? I couldn't.
No, because you said the restaurant wouldn't let people in that had the vaccine, right?
Right.
Yeah.
Because they thought those people who
Would
were
upset-
vaccinated had cycle differences, and we're going to impact the cycle differences of people inside,
I thought it was
which is a lot of personal information that nobody has to get into. I'm like, I was like, do you want to provide proof that happened? Should we do like a small cohort study?
Goodness.
Like
Evidence-based practice at the vegan restaurant about cycle changing due to vaccines. I am so far outside of my scope of practice at this point that none of those except vaccine apply to me.
You are married to a woman, so
that doesn't make me an expert.
A lot of
at
people
all.
will hang their hat on that. That's true.
My wife is also a biology major, but that doesn't mean I understand animals.
I realize that, but you should have a baseline understanding that.
I have 3 kids. I don't understand it.
Or you do.
I do have a question though about like this requirement of
like an identification.
Identifying yourself as having a vaccine. Even if they made this up to the employee that they have to give, that basically they have the right to refuse or accept sharing their status on their badge, you're going to probably have a pretty accurate number anyway, because anybody who's vaccinated is going to want to let you know.
Right. I saw it the other day. It was like a vaccine is like CrossFit. All you have to do is wait 30 seconds and someone will tell you that they got it done.
Ruchi is like waving off
No.
the mic right now.
I wish no, because Matt's gonna be like, turn the mic down.
No, you're good. But yeah, no, you're right though. I mean, I don't know. I feel like, so this is my process or my thought process. We work with patients. We work with folks that are vulnerable. We work with folks at their lowest sometimes. We need to be as transparent to them as possible. So I feel like badge identification or religion, whatever the patient needs to know that we're buying into what they believe in, I feel like we owe it to them so that they have faith in us. And like, the reason I said the religion thing for a second was I had a patient ask me, she was like, I don't care what religion are you, but are you religious? And I was like, yeah. And she goes, okay, then I can work with you. And I was like, all right. And if I would have said no, probably would have had to transfer you to the other SLP. But I don't know. I feel like our patients deserve to know what they need to succeed, because, you know, they need to know that we're buying into why they're trying to improve or repair or rehab or whatnot.
Yeah.
I don't know. Sorry to take it from fun and whatever to more sober and serious. So my bad, guys.
No, I mean, I think there is a baseline connection that people are going to look for in someone that they're establishing a therapist-patient relationship with. And if that is one thing that's going to make them more or less comfortable with a therapist, then I would encourage them to find someone who meets whatever they're desired.
And I hate to say it, but if I found out my nurse was anti-vax, I don't know if I'd want them working with my kids.
And that's, I mean, I think that's what we have to remember, is that it's the patient's choice.
Yeah.
We probably lost some of our listeners at this point. That's
no.
Yeah, that's true.
All 8.
But if you're also dealing with
anti-vaxxers.
somebody, I mean, but if you're dealing with somebody who's a nurse versus a home health practitioner, like there's a different kind of
true.
impact of, you know, volume of patients that you're seeing, and
Good call.
whether one needs to get vaccinated more than the other. I mean, I have my own perspectives about, you know, how I feel about vaccination, but, you know, and that every healthcare provider should be, but, you know.
Yeah. What was it? The thing that always gets me is that baby with all the needles in it. And they're like, this is how many vaccines. Have you seen that? It's like a parent thing, maybe, where they'll be like, this is why you should vaccinate your baby. And it's like a baby full of needles. And they're like, this is how many shots they get in 5 years. And it's like, well, yeah, that would be terrifying if I got all those shots at the same time. But like, it's spread out. You're okay. And some of them
also,
are in one
if you
needle.
can get it all over with and not remember, that's also totally fine with me.
Yeah, because I found out the other day that the $200 lightsaber I built with my 8-year-old when he was 6, he doesn't remember. So that was fun.
Yeah.
Anywho, if you've got something you want to bring, this is another one where we did a due process.
Show him pictures and stuff and like help him.
Thank you. Okay, early interventionist.
That memory.
Oh my gosh. All right. Now, if this is the second due process where we've all been kind of agreeing on the idea. So if you've got a due process, something you want to bring to the court of public approval, hit us up. It is #SSPod due process. And you can do that over on our website, speechsciencepodcast.com, email speechsciencepodcast@gmail.com, phone call or text 614-681-1798, or the Discord. All right, y'all. Let's hit to the news articles. This first one is coming out of the New Orleans City Business by author Aqua Stovall, who is the founder and executive director of Special Education Leader Fellowship, a nonprofit organization supporting school leaders and teachers to create authentic student support programming. Her article talks about how we need to be prepared to address not just the needs of our students that are returning into the school, but also the trauma and the special needs of our students returning to a building for the first time. And she goes on to talk about not just being in the building for the first time in a year from COVID, but also the race-related health inequalities associated with the pandemic, and also being around other people for the first time in a year. And I figured this would be a great jumping off point that we can talk about it, not just for our students, but for our patients in private practice and home care and people finally going back to outpatient therapy. I know I'm barely able to handle normal trauma of stroke and dementia rehab and IEP rehab or trauma. This is adding a whole new level that I know this summer I'm going to be spending a lot of time researching on just how to handle that.
I feel like this is kind of twofold. We talk about our kids returning to school with this trauma-related experience, and I I think in order to address that, we have to also kind of address our own trauma and our own experience with the past year and a half that we're going on of everything in our world being shifted. Some things completely upended, some things just slightly different. And kind of, have you guys heard of the whole locus of control thing? But that's one thing that I've talked about with kids before, and I got it from our school psychologist when I worked in the school, was just talking about what are things that are within our control and what are things that are outside of that. And you can even draw it out with young kids. And by no means is it an answer, but it kind of gives a visual to say, hey, these are things that I can control. These are things I can't. And what's going to help me with coping strategies for the things I can't.
I like that idea. It's kind of like grabbing the oxygen for yourself before helping the kids on the airplane.
Yeah.
How do you handle this on the private practice side, Ruchi?
Well, everything I do is via tele, and I try to normalize that people can, take breaks, talk about what they need. I've been a little bit more flexible on rescheduling in my practice because of the things that can come up that can be traumatic for folks. I do want to give a shout out to everybody who's going back to hybrid or in person in schools, as well as people who've been working, as healthcare workers throughout the year, that it is, there is a pressure from employers oftentimes to give the face of normalcy in these situations. And then that's just not the authentic thing that's happening. And I think, as somebody who has not worked in schools in a long time, so with that, with humility, I would say that talking about how everybody's figuring out and restructuring in their lives and figuring out how to socialize again and feeling safe about that. And, for me, it's hard to attend in a meeting now. It's hard for me to go in a group of people and not feel somewhat isolated, even if I like everyone who's present, I don't know.
Sorry,
if
that just
that
made me
might, but
laugh.
I think that's also a remnant from before, Matt, that I didn't actually actually investigate. But I think if anything, COVID has brought to light very true aspects of my personality, which sometimes leads me to be a little bit of a misanthrope, a little bit of a curmudgeon. I'm trying to accept that. I think I'm cute enough to get away with it, but at the same time, especially when working with kids, I think when they know that they're not the only person dealing with adapting, and that there's something universal about this piece and normal about this piece, then it kind of takes that little level of pressure off, or that buffer off a little bit. So
I worry. I don't want to say I worry. I'm concerned for some of my students who have, or not just my students, just students in general, who have picked up certain behaviors or have done kind of like what you said, inability to sustain attention during a meeting. And they're going to be forced back into schools. They're going to, or I'm not forced back, but they're going to go back to schools. And the teachers that have been in person are going to expect some of that same attention ability that their peers have because they were in school for a year. Because where I'm at, the kids had options to either stay home and do teleschool or go in person. My son's one of the ones that did virtual school. And I know that his attention span of doing schoolwork here was 20 minutes of schoolwork, 10 minutes of play, 20 minutes of schoolwork, 10 minutes of play. He's not going to do that at school. And I'm already prepared for the phone call of, hey, your son was acting up after 45 minutes in the building. And he is technically neurotypical, thriving little, going to be second grader. I can't imagine you add in a little ADHD or a little autism or a little cognitive deficits or a little language delay or anything. You know what? I like both of what you all said. Like, we have to identify what we're bringing baggage into to it as well.
Mm-hmm.
Matt, I do have a question, and to Michelle too. In your settings, do you have an opportunity to have these like interdisciplinary conversations about the shift with like school psych, with social work, with any OTs or PTs who are contracting with your school or with your agency?
So I'm not saying this because I work there currently, but I moved to my school district last year, and it was probably one of the best moves I've ever done. We have an interdisciplinary team meeting every 2 weeks where PT, OT, myself, the psych, the special ed supervisor, the principal, and then the social worker, if they're available, all meet and discuss the needs of the students. And we discuss, this hasn't come up yet, but I can see that it being a topic for discussion coming back in the fall. So I'm lucky that that is something that I have in my school district. But the previous 2 school districts I worked at, it was a monthly meeting with all the SLPs, all the PTs, all the OTs in the district, kind of being told what was happening while we all sat in an amphitheater, while the person in charge walked back and forth telling us what was needed to be done. So I know not all buildings are like the one I'm in.
And for me, I'm not currently working with my little tiny one at home, but was fortunate in the last couple settings I was in to have an interdisciplinary team. But I feel like it's shifting so much, and I kind of want to know from you, Ruchi, what your thoughts are on that, because you're doing the private practice and you said primarily teletherapy, and so many of our kids have been receiving services, including the clinic I used to work for, has been doing teletherapy services over the last year. And even when I went back, so I was off for 12 weeks and then went back to employment, seeing kids in a clinic setting with the pandemic. So last summer started seeing kids again, that it was suddenly a visual difference too, right? So suddenly I'm in a gown and a shield and a mask instead of they run up and give me a hug right away. And now I'm across the room waving at them like, it's really still Miss Michelle, I promise. And, take off the mask when they're outside the window from me so that they could see it was me. So I think there's this shift that has had to happen.
Good point.
And that kids have, especially young kids, you take a 5-year-old, a year is a fifth of their life. So that has been their reality, right? When you have those young kids. And we take it as kind of a sad thing, but it's also, I think, a strength, their adaptability with these changes, that if they're with support going to be able to adapt again, right back into what that new norm is for the school. And just like any school year, because I know you're in a school, Matt, my thought would be we have to adjust things every year. This adjustment might be a little weirder, but a little more uncomfortable. But we're going to have new kids coming into school. We might have kids who were homeschooled, or kids who were at a public school and now they're at a private school. There's a lot of shifts that happen when you start a new school year. So my thought is just giving ourselves a little grace and allowing our students some time to adjust is the most important thing.
Yeah. And flexibility of on lines and considerations for the classroom as well, as much as possible, and I try to hold back from making those kinds of recommendations because there's so much on the shoulders of our educators, and there's so much on the shoulders of our school-based SLPs and everybody else who's on the IEP team. But if we start making considerations about making the classroom even more inclusive and adaptive, like globally, as we would for a lot of the populations that we work with ADHD considerations, with autistic students, and any other neurodivergent considerations, that might be really helpful in the interim. So
I have a question for you, Ruchi, that feel free to not answer if it's too much into HIPAA. And I know that you did a lot of the gender affirming voice work. Do you find that patients were more open to trial new things or to identify deficits teletherapy wise, working on their voice work? I found that my adult patients with stroke and rehab were actually less likely when I tried to do some teletherapy with them, because I don't know if it was like the barrier, but I was trying to, I didn't know how that worked with what you did.
So with the clients that I work with, and some of them are voice students, and I provide singing and speech voice services, a lot of these people are motivated to check in and make changes.
Okay.
Certainly, there are some advantages in that, like when I'm modeling something, the client has to take the onus and responsibility of being able to reproduce it on their side, which means that their likelihood of having some carryover might be better than if I was there and asking for, permission to, do any myofascial release kinds of things or alignment kinds of things in terms of voicing. You can obviously take recordings from a client, or a client can send it to you through a HIPAA compliant server, and you can do analysis of the recordings as well for basic pieces. So there's a lot that can be done. I don't, because most of my voice work has occurred like post-pandemic start. I don't have anything to compare to in terms of voice work, because I was working full-time in acute care and some acute rehab placements for much of my early career. So yeah, I will say that when I was also employed for, I won't name the company even though they're great. I worked for a teletherapy company where I was providing comp services specifically with autistic students in high school, and all of them were using like AAC modalities or alternative communication modalities. That was hard. And if I had not had somebody who was like a para or an
With
assistant,
them,
there would have been no way for me to do anything useful, but it was still really challenging because I know that they would have benefited a lot from just having a person directly there, having tactile cueing and some environmental supports and controls to support their success. So
yeah, I was just wondering about voice, because I feel like with voice, patients are usually a little bit more open to trialing new things to get their voice to where they want it to. Where my experience with like stroke and dementia, sometimes they just don't know their deficit, so they're unwilling to try.
I mean, in my case, the cool thing about Zoom is you can turn off your camera. People can take breaks. They can they can disengage if they, emotionally need to, if there's an issue in terms of anxiety. But which you just did to me, which is really awesome.
Checked out for a moment.
And I was like, where'd you go, Matt? But I mean, I think it's just a highly different modality. Would I like to eventually work with people in person? Yes, I think there's always going to be advantages to that, but I also like that it kind of pushes a client to start to become their own clinician because of that little bit of barrier. So,
and I mean that is our ultimate goal, right? Is to work ourselves out of a job with a patient. We don't want them to need us forever.
Yes, my favorite phrase. Absolutely.
Oh, we want to hear from you. What do you think at home? Head over to our website, speechsciencepodcast.com, email speechsciencepodcast@gmail.com, or phone call text 614-681-1798. We got a voicemail this week and I was super excited. And then it was like legit just a warranty on our car.
No, a fake warranty call.
It's like, no. I was so excited to have one to play on air this week, but you could be that phone call. Let us know what you think, what you're going to do for your patients or your students. Switching gears from trauma-based therapy or trauma, what is it called? What was the word I was trying to find? Trauma-informed lens.
Care.
That's the word I was looking for. Guys, I'm not kidding that since COVID, my brain fog is terrible and I have aphasia every day. So just saying. Transferring, anyway, going from that to this, a new study. This one's coming out of Parkinson's News today, and it was a study originally linked. Oh, where's this one from? It was the impact of progression of Parkinson's disease on swallowing ability in oral environment. They looked at the impact of how much does a patient identify how well are they swallowing with late stage Parkinson's. And I know I've got some patients that I've worked with in the past with Parkinson's. Michelle and Ruchi, do you guys have it, or do y'all have any history with working with Parkinson's patients?
It's been my primary by any means, but working in outpatient therapy and in acute care, yes, I had some patients with Parkinson's.
I too have had some patients with Parkinson's. I mean, and I did LSVT lab training as a graduate student. Somebody recently, I'll give a shout out to Teresa. Yeah, thank you for helping me with this. But I completed my speak out training during this time as well.
Ooh, nice.
So, yeah, so it's just like, you know, I'm gearing up
bits
for
and pieces, so I would love to do that full training at some point.
Yeah, it was pretty awesome. And you know, I've done a fair amount of dysphagia assessment and management in those settings, and so we do tend to get folks with Parkinson's as well.
So the study looked, and I'm going to cheat and go right to the conclusions. It's linked in the article that we'll have linked below, but it says the results indicate low self-awareness of dysphagia among patients with Parkinson's. They also note that screening for dry mouth, or how did you say that, Ruchi?
Xerostomia?
Yeah, I write this stuff down. I never say it out loud. Dry mouth and oral care and moisture are recommended for patients with PD with dysphagia and receive high doses of levodopa.
Is that a common medication, I'm guessing, for...
I was reading about it. It's a replacement for dopamine.
Okay.
Thanks. I guess I've always screened my patients with Parkinson's for dysphagia, but I think it makes sense that a lot of our patients that with advanced Parkinson's don't realize their eating habits have changed so much.
Well, and I'm probably sweeping like way too broad a scope with this, but I think it's pretty common because dysphagia is something that progresses often slowly unless you've had a trauma or some clear-cut change. That as people age or as a disease progresses, like Parkinson's, they may not notice. We may not notice. We as professionals might, but we as individuals might not notice those changes in our, our eating and swallowing.
Absolutely. And I think the bigger impact too is like how much carryover is there? Are there caregivers and other family members in the picture kind of maintaining a structure around what oral care looks like, making sure they're managing their xerostomia.
Oral care.
Exactly. Like, I mean, as much as you can push on that. And then, they talked a little bit about in this article about how primary care physicians don't have access to video fluoroscopy and endoscopy. And I'm like, yeah, you shouldn't, because you're supposed to refer.
I was going to say somewhere the Swallow Your Pride, Teresa Richards, Vince Clark are rolling over screaming and get your mobile fees through.
I was like, write the script though. But yeah, like that's what you do. I think, remembering that all of these patients have to be managed individually. There are so many considerations in terms of comorbidities to take into consideration, which I briefly looked at this article and I don't know how much has been explored in terms of how they determined the cohort that they were doing the study on. But
their data is available upon request.
Okay, you request that for me, Matt, and then you share it to me in the group chat. Okay, but all of those considerations have to be taken into account. How happy is the client? How much can they participate independently? How much agency do they have in terms of making food choices and requests, and just supporting them and being able to maintain, of course, least restrictive diet is great. But I feel like they talked a little bit about scores here, but they didn't necessarily talk about outcomes with regard to actual instrumental like swallow evaluation, which I think is interesting.
So the only thing that I could find, it said that 29.5% of the participants were defined as dysphagic. However, most were still on normal or only slightly adjusted diets. And they say that the results indicate low self-awareness of dysphagia. But part of me also questions that, like, I've worked with Parkinson's patients before where I've said, hey, your swallow study and my clinical opinion think that you should be on Mexsoft or lower food. And they're like, yep. And they're eating their McDonald's cheeseburger and saying, I know what you're saying, but this is my quality of life. And I don't know if that is an indication that they don't have self-awareness. Does that make sense?
I mean,
It
would tell you
depends
the
on
same thing,
person.
Matt,
Yeah.
tomorrow.
Right, exactly.
Yeah.
I'd be
Yep.
like,
I think it depends on the person, and it depends on the patient, and it depends on the team, and what the medical needs are, and like you said, that's their quality of life, and
But I
okay,
guess
what mitigating factors can you teach them? What oral care? What supports can you put in place to minimize
right.
a
And when I look at
negative impact?
Exactly. And when I look at a study like this speaks to me more about you need to telegraph for a patient where things can go and what they can do now and what caregivers can do now to, have these mitigating factors present, right? And also anticipate if there are going to be changes as things advance. And if they're participating in therapies that have high levels of social communications, and we have an intervention like LSVT Loud or Speak Out, and I know we'll talk about whether there are studies to support certain interventions, but that's for another day. But if you're having something that is impacting both volume and use from an exercise physiology standpoint of the mechanism as a whole, how is that impacting swallowing? There are a lot of questions in that that are raised about swallow function in those settings. So
I think it's interesting, and the takeaway that I'm going to take from this is that with my Parkinson's patients, I'm going to have to pay attention more to what kind of medication they're on, and besides just what does my system say is a what do they call it? A serious interaction between two medications. Basically, we use a system called NDoc. We put in all the medication, and it warns us about any adverse crossing of the medications. But what I'm going to pull from this also is I'm going to start looking at some of the medication and see if it's a higher dopamine type medication for some of my Parkinson's patients, and then do more education if there is about the importance of oral care. I mean, I already do, but at least from this, it looks like higher dopamine means drier mouth. Drier mouth means more bacteria. More bacteria means pneumonia.
Yeah,
I think.
Yeah. From a just surface level perspective of this article too, you made me think of this, Matt. It's from Parkinson's News Today, right? And the heading is, at least I had this reaction, and I think Ruchi said the same thing of, this doesn't surprise me. As a speech language pathologist, this doesn't surprise me. Study ties swallowing abilities to disease progression. And I'm like, well, of course. But it makes me wonder if even people with Parkinson's or maybe other diseases or diagnoses don't realize that that is directly tied with the progression of their disease.
That makes sense.
Yeah.
I had a patient before tell me when we made a diet change that they were never told that there would be swallowing problems with Parkinson's.
Right. So it makes me think, what do we need to do? Which I know we're always putting more on ourselves and SLPs. What else do we need to do? But
Speech therapist changing the world.
But yeah, one patient at a time, right?
Oh my goodness.
Well, I mean, get it on the list of the PCP who doesn't have access to the video fluoroscopic study or to the fees system. Tell them that you should add that bullet point to your list.
It doesn't have access to it. Like, what is, like you said, a referral, and then you can read it. You can look at the results of that. What do you mean?
But
don't have
yeah,
access
exactly.
to it?
And all PCPs and all neuros should be including this in expected symptomology or considerations, right? So
we have a pretty nice unit up near where I'm doing home care. It is a mobile modified barium swallow unit. So it's not a mobile fees, but
Ooh, I like it.
They show up in one of the big old style vans. They come and they have a Hoyer lift on the van if needed. They come in, get the patient. Patient can go out to their driveway or the parking lot of the nursing home, get it done, and then they email the most beautiful 10-page report about swallowing that I've ever received. They send you a digital copy and a CD of the video, and they'll actually also follow it all the way down till it empties into the stomach.
Oh,
And
so they'll do a esophageal sweep too.
Uh-huh.
Wow.
I
And
have
it
flames
is
on my
awesome.
face right now, Matt. I am so angry.
Why?
Because I want to be there, because you
okay.
painted a field of dreams.
Yeah, that's great.
And like and here is the part that I love as a introverted extrovert therapist. However you want to call it. I'm either extremely extroverted for being an introvert or an extremely introverted extrovert, however you want to label it. I don't have to call them. I can just fax them over the referral, and then they'll call the doctor to get the order, and then contact the insurance to get the approval, and then they'll call me just to say that it's been confirmed. I love it. Like, it is.
Okay, so you're going to tell me when y'all are hiring, right?
It's not me. It's not my. It's just one of this mobile unit up in this
That's
area.
awesome.
And
That's so cool.
I like, if y'all don't have to call, like, if some people listening may not understand this, like in home care world and a lot of like the private practice world and in inpatient world, we have to get orders from the doctor to see our patients, and every 60 days I have to call these doctors to get orders, and every phone call works like this. Hi, I'm Matt from the so-and-so home healthcare company seeing Dr. So-and-so's patient, birth date XXXXXXXX, and I need a verbal order for speech therapy to continue. Okay, why are you calling us? Because I need the verbal order. Well, yeah, they need it.
Like, okay, so that's a verbal order, right?
Can I have your name so I can put it in my chart? Yep. Okay, thanks. I hate it. So when this company is like, just fax it,
in
and
the
we'll
hospital,
call it.
I had to do that too. Yeah, that's
so
true.
nice.
So I'm just bragging, just humble bragging over here.
I'm happy. I'm happy for your patients that they have access to something like that, and then you can actually implement a meaningful treatment plan as opposed to like.
Right. I had a patient cry because I helped them answer a question that has been bugging them for 15 years because of this.
Wow.
And then they followed my bowling team at state championship, and they were disappointed we didn't win. And I was like, I can't help it. I didn't bowl. So to my patient, shout out. You know who you are. On the flip side of the break, we're checking in with the Informed SLP. We've also got the ASHA Spotlight, and then we are wrapping the show up. We want to hear from you, though. Head over to our website, speechsciencepodcast.com. You're listening to Speech Science.
And now for our regular research review, brought to you by the Informed SLP. The Informed SLP releases a monthly newsletter that brings you plain language reviews of only the newest, most clinically applicable research, keeping you up to date on advances in the field and saving you tons of time. So let's get to it.
This is a review of the article, Evidence-Based Recommendations for the Oral Health of Patients with Parkinson's Disease, published in Neurology and Therapy, and this is an open access article. You're seeing a patient with Parkinson's disease who's complaining of difficulty swallowing. Your exam reveals that his overall oral health is in need of some attention. We know that the state of our mouths has a lot to do with how we chew and swallow. Maybe this is contributing to his difficulty swallowing. Martin Bianco et al. Performed a systematic review regarding oral care in patients with Parkinson's and came up with a thorough list of evidence-based oral hygiene recommendations for dentists and physicians. But we can also pass along this helpful information to our own patients. After all, maintaining a clean, pain-free mouth with strong teeth will mitigate lots of other factors that contribute to oropharyngeal dysphagia. General dental care. Advocate for regular dental visits. Educate and instruct on regular quality teeth brushing, preferably with demonstrations using both arms, and provide oral care instructions that are individualized to each patient. Next, salivation. Patients with excessive dry mouth may benefit from artificial saliva products. An intervention like Botox may be appropriate for patients with excessive drooling. and advocate for referrals to manage common salivation issues in this population. And next is tooth decay or loss. Parkinson's disease is associated with receding and bleeding gums, plaque, and mobile teeth. Improved hygiene can lead to less tooth loss. Because of the high frequency of untreated cavities, patients with Parkinson's may need support in getting implants or dentures. And be sure to educate on proper denture cleaning too. And last, temporomandibular disorder, or TMD. Be on the lookout for TMD in patients with Parkinson's, which contributes to pain, orofacial dysfunction, and the overall burden of the disease. With proper identification, TMD is treatable. Discuss the right referral for treatment with the physician. Educating and advocating for oral care is a big part of our job already, so we're well positioned to be using these recommendations as teaching points for our patients with Parkinson's. If they don't have an established dentist, we may very well be the only providers taking a thorough look in their mouth. Your contribution to their overall oral health could have you both smiling a little brighter.
Thanks for listening to this review. If you're interested in more, come visit us at www.theinformedslp.com. Tell us how you put the research into practice, or find us on Instagram, Facebook, or Twitter at theinformedslp.
Welcome back to Speech Science, episode number 143. I'm Matt Hott, joined by Ruchi Kapila.
Hi.
And Michelle Wintering.
Hi again, Matt.
See, we just say hi a lot on the show, Ruchi. That's all we do.
She looks up going, do I say something?
Do I have to respond at this point?
I was like,
Yes,
I
you
said
do.
hello again. I mean, I was like, we've been talking.
So right before we came back on air, I said I was trying to remember how to count backwards. I have picked up the app Duolingo. Have you guys messed with this?
Oh, yeah.
Oh,
I
yeah.
like that one.
I am trying to relearn the German that I spent 8 years learning in high school and college. And I have forgotten almost everything. I might as well have just picked another language to relearn at this point in my life.
You can do it, Matt. I believe in you.
Are you guys learning any new things? Not speech related?
Not speech related.
Wow.
Personal enrichment.
I'm learning about buying a house right now, Matt.
Oh gosh, don't do that. It's terrible. It's the worst time to do it. Sell your house, live like a caravan, and
I
then
have
when
to
the
own a house to sell it. This is my first
and
time.
then when the market
buying a
crashes,
house.
you'll be fine. And also buy Bitcoin, because my Bitcoin has lost 50% in the last 6 weeks that I've bought it, and now it's only worth $40. I'm just so sad.
So, anyways, there you go. I'm learning about real estate. and
Ruchi, are you
mortgages.
learning any personal enrichment stuff? Real estate, second languages?
I'm learning how to socialize again. That's really what I'm doing. It's taking up a lot of my cognitive reserves. So thank you for letting me practice here.
Hey, no problem. You're more than welcome to join our teletherapy weekly sessions here on Speech Science. We'll do it every
for
day.
each other to ease each other back into this. But we've been seeing each
Nice.
other's faces the whole pandemic. So
That's true. We haven't stopped seeing each other. Oh, all right. Every week at this time we do, not every week, every episode at this time we do an ASHA spotlight, where we look at something ASHA is doing either positive or negative. And did you guys remember to vote on the slate of candidates that you have no choice on making? I did.
I didn't this time.
Yeah. Did you vote this year, Ruchi?
I feel like I was probably tricked into it and regretted it ever since.
Yeah, like once I saw that there were no like decision making, it was like the candidates were the slate of candidates. I decided I'm not voting.
Right.
Like it's a waste of time. But on a positive, that's the negative. On the positive, the point of the spotlight this week, the Medicare, this is actually coming out of the ASHA leader. There is a Medicare audiology bill that is a joint bill between ASHA, AAA, and ADA. So I just figured that was a nice little spotlight moment, because we never really get to hear our friends over at the American Academy of Audiology, and of course the Academy of Doctors of Audiology, agreeing too wholeheartedly with what we're doing over here in ASHA. But this Medicare audiology bill, they are in lockstep. So I figured that's a nice little moment to shine a positive light on something Asha is doing.
There you go.
So
yay,
nice and easy.
ADs and yay, Asha.
You know what? I really don't care. Whoever can get me and my daughter funded for cochlear implants and hearing aids for the next 18 years, you will be whoever I pay my yearly dues to. I don't care at this point.
And beyond. She's going to need them past 18.
A positive. Well, yeah, but then she'll be on her own and I will not be on my insurance and she can take care of herself.
I know, but we still need insurances to cover those things.
Oh yeah, good point. But it won't be my insurance.
Yes.
Not under my roof. Positive. Unaided. I don't know if I told you guys on air, her speech or her unaided on her good ear is just below the speech banana now.
Ooh, that's an improvement.
Yeah. They told us it wasn't improvement. It was just more likely and more accurate reading than what we got when she was born.
Okay. Improvement in the reading.
Oh, yes. Oh, yes. Sorry.
Improvement in the participation.
On the bad ear, she still cannot hear a jet take off at 3 feet. So there's that.
Okay.
So positive. So as we wrap up this week's show, I pose this question to you all. With a couple weeks left until summer break, what is your plan for this week? And then what are you looking forward to for summer? What is something that you want to do this summer? To give you all a moment to think, I will give you mine. This week, we wrap up with our schools. And so I'm excited because that means picnic time for 7th graders, 8th graders, all of my self-contained classrooms. Mr. Hot is going to be at a lot of picnics in the next 6 days. And then for the summertime, the thing that I am looking forward to the most non-therapy related, I would say just the ability to have my family over once in a while and just like not have to do the awkward, have them stand at the edge of the driveway behind a chalk line and like we drop off our gifts. Like it's some weird hostage negotiation of like, we put it in the middle and then we back up slowly and then they come and get it. Like, that's kind of what I'm excited for. What about y'all?
Well, mine was similar to yours, was seeing family.
Oh.
Because it's been too long.
Well, if you come to Ohio, you can see them all the time. And we would hang out, just saying. Ruchi, you can come to Ohio too. We can hang out when you're going to Texas. So
I know Matt and I had plans to meet up and then when I was only 2 hours from him in Kentucky.
And then she drove away.
And then we moved to Kansas. So we're a military family, so we have moved a lot during the podcast.
That makes sense.
She uses it as an excuse to abandon our friendship.
Yeah. So just in this podcast, I've been in Colorado, Texas, Kentucky, Kansas, and now back to Texas. So,
wow. No, that is a lot of moving. That's a lot of moving.
Yep. So we are moving again. So I guess I'm looking forward to not moving again in another year because we will be in Texas for a few years.
That's awesome. I'm so glad to hear that, Michelle. For me this week, it's just wrapping up some things in the Bay Area, seeing some friends and family before I head off. And like I said earlier in the podcast, I'm visiting my partner, Blake. Hi, Blake, in Texas.
What's up, Blake?
Thank you, Matt.
I hope Blake can listen in.
Blake is a big podcast aficionado and geek, so I'll make sure that he listens to this episode. But I'm flying in next week to Texas. Booked a one-way, so we're just going to see how things go. Going to be kind of adventurous and try to work out because I do most of my stuff online, work from Texas during the summer, see how things go. Yeah,
that's awesome. That's such a fun idea. And before you go, Ruchi, let's plug all your cool stuff that you do.
Oh man, okay.
So first,
get it together.
Let's plug the Hyndsyte Project. What is
the Hyndsyte Project? Okay, the Hyndsyte Project podcast is one that I co-created and co-host with MarissaMM. We interview Black, BIPOC, trans, and gender non-conforming activists and artists. We start in the Bay Area, but we interview people across the country, probably across the world eventually, if we get that far. I just started my private practice for gender affirming voice services for singing and speech. It's called Kapila Voice and Speech. It's going to be hard to remember the web address, but it's at kapilavoiceandspeech.clientsecure.me. Again, it's kapilavoiceandspeech.clientsecure.me. But if you forget, you can follow me on Facebook or Instagram at Kapila Voice, Kapila. And I'm also, please follow at Festival Opera. That's an opera company in Walnut Creek where I am their director of social media and marketing. I also have a podcast for them, which is actually, we have on YouTube primarily right now, called Behind the Mask. And we talk to artists about their really raw blood, sweat, and tears experiences in terms of opera and classical singing, classical music. So check us out at Festival Opera on Instagram and Facebook, or festivalopera.org.
You are like becoming my favorite new person, by the way.
Yeah.
I didn't know you did all of that. That's so cool.
I just added Kapila Speech to the Speech Science Instagram. So if you need to find her, you can find her from our account as well.
Yeah, Kapila Voice and Speech, yay. And yeah, there are more things on the list, Matt, but like, you know, you only have so much time, right?
Hey, I was going to give a shout out to your show, and I was trying to figure out which episode it was. Which episode were you talking to the person that did theater stuff? Was that Leo?
I think it was Leo. Leo is a wonderful person. That
was one of my favorite episodes.
But like, it was so good. It was so good. It was so alive. And so I love just having conversations with people, which is why when you invited me today, I wasn't going to say no.
You're like, I'll jump on and no idea what's going on. I'll do it right away.
Absolutely.
Well, awesome. We'll have a link to all your stuff down below. So that means I will ask you in chat to send all the links.
Thanks, Matt.
I need to put that all over there. Our intro music tonight was Please Listen Carefully by Jazar. It's licensed under an attribution and share alike license. Our bump music was the County Fair Rock, copyright a John Deku. Find his music over at soundcloud.com/dirtdogmusic. The Informed SLP was At the Count by Broke for Free, licensed under a Creative Commons attribution. And our closing music playing right now, it's a Slow Burn by Kevin MacLeod. It's licensed under a Creative Commons attribution license. In the immortal words of Janice Wright, always be a willow. The oak looks strong, but in a storm, the oak will bend and crack. The willow will bend and return to form. For the missing willow, Mike MacLeod, and fellow willow, say that 3 times fast, Ruchi Kapila, Michelle Wintering, and myself, Matt Hott. Until next week, so long, everybody.
Bye.
Bye.
Thanks, Ruchi.
That was so much fun.
Speech Science is edited and produced by MWH Production. Please follow Speech Science on Twitter at Speech Science PC and like our page on Facebook. And rate and subscribe to our podcast anywhere you get your podcasts.